lactation consultant. So today is another topic that I want to demonstrate and discuss with you. Another topic that I want to share, especially for those moms who gave birth to babies who are smaller babies, okay? I had a video that shows about babies that are so big, or a baby is a normal size, but the mom has a very short extremities or hands. So this time, I'm going to demonstrate paano kayo mag-breastfeed ng baby who's a smaller baby or a baby who's a preterm who has really difficulty latching. So I have two babies here that I want to compare, okay? So this baby is like a full-term baby, okay? Probably about 7+ pounds, okay? So this is a typical normal size of babies. 6 to 8 pounds is a normal size of baby. So this is like a preterm baby, okay? A preterm baby may be born like, let's say, 34 weeks, 36 weeks, or maybe I've seen in my nursing career, the youngest baby that I took good care of as a lactation consultant was a baby aged 26 weeks. Could you imagine? A baby is 26 weeks. So for maybe 5 months, 6 months, something like that. My math right now is I just woke up. So could you imagine with a mature baby, a full-term baby and a preterm baby, and you are trying to latch either this one or this one. So a smaller one is what I'm gonna be focusing today, because most Asian babies, based on research, are smaller babies as compared to the Caucasian babies, the Western babies, okay? So when you have a small baby and you have a bigger breast, it's double challenge, okay? It's double challenge, because could you imagine your baby is too small and yet you have a bigger breast. If your breast is just the size of a regular Asian size of breast, okay? I'm not generalizing this because there are also some Asian right now with mixed culture also are a bigger breast now. So that's why it's always good to compare. Normally Asian size, or if you have this size, then it's gonna be a double struggle. So when you have a normal shape of breast, if you're Asian, and then if you have this size, if you are still Asian, okay? Now, when you have a baby that's smaller, your breast is bigger than the baby's face. Okay, so look at this way. So the baby's face is smaller than the breast. So now we're gonna figure out how can we breastfeed this baby comfortably if when your breast is bigger than baby's face. So one thing that you always remember, and I've said this one in my previous video, when you look at your baby after you gave birth, so if you're pregnant right now and you're watching this video, you have to remember this, okay? Always remember that Nurse Alona, Lactation Alona, said, when my baby is born, before I even first latch my baby, look at your baby's mouth. Look at your baby's mouth. So what's that mean is, I want you to look at the baby's lips. Always look at the baby's lips. Why? These lips are the biggest factors that can really affect on how to latch this baby, especially if this baby is very small, okay? Now, when you look at the baby's lips and your nipple is bigger than even the baby's mouth, there's a struggle. There's gonna be a struggle. However, when you learn the right way in how to reshape your breast, I've showed this before. When I mean reshape, it's the way how you're holding your breast. So reshaping it. So let's say, for example, okay, prior to you latch this baby, prior to latching your baby, always remember this. When you massage your breast, it really helps to reshape it. Reshape the nipple, or you can do nipple correction and reshape the breast because it's gonna get softer. So what I advise for babies are like this. I would suggest I want you to gently tug your nipple first, make it pointed, make it protruding. Tug it first, okay? Tug it first. And then massage it, especially around the areola part. This areola, the pink, massage it there. We want the part of the areola to be softer so that the baby will be able to latch deeply up to right into the areola portion. So we're massaging it. Once this one get protrude, meaning it's pointed, and your breast is a little bit softer, then that's how you do the C-shape hold, the V hold, or the U hold. So again, I've been doing this one again, but for some of you who are just my new subscribers, or if you're pregnant right now and you really want to gather some ideas, bago kayo manganak, this is the time that you really have to learn on how to do it right. Because when you're in the hospital, after you gave birth, when you're in pain and the nurses are running around like a crazy, there's not just you in the hospital. So this nurse is may have no time to help you. So it's always good to make sure, have your own knowledge right now before you even go to the hospital or after you give birth. So a C shape is what I truly recommend, which is very, very good when you are latching your baby. So I want the baby's mouth to be around the areola. Now, if the baby's mouth is like that, is it possible that the baby's mouth would be really fully around the areola? No. So that's not the reality for this small baby. However, if the baby's mouth is just at the tip of this nipple here, there will be no forceful suctioning when the baby's latching. And you can feel it. The tagging sensation, yung tinatag ba yung breast mo when the baby's sucking, you really feel that. If you don't feel it because the baby's sucking mechanism is weak, baby's lips tone is really weak, the baby's mouth is too tiny that the baby's mouth can only latch right up to the nipple, then it's a struggle. So how you're going to do this, especially for the first few days, that this baby is gonna take a while. It may take weeks before this baby would really breastfeed effectively. Now, what you're gonna do, I want you to massage your breast, express your milk into a cup or into a bottle, even droplets or into a syringe, and make sure you gave that to the baby. Keep trying on latching the baby. It may not 100% perfect for the first weeks after you gave birth, because this baby probably still gonna need some help. Mahirap kasing every baby is different. So there are some babies na after a week, kayang-kaya na mag-latch the baby kahit maliit si baby. There are some babies that after even months, babies start struggling with the latching. So you can play by ear. What you're gonna do, you pump, you express your milk, you put it in a cup, you put it in a spoon, you put it in a bottle, feed it with the baby, and then continue latching. Never abandon never stop if you really have planned to really breastfeed this baby. Never abandon even one day na hindi ka magla-latch. You need to latch. Always remember, before introducing anything, before introducing the bote or before introducing whatever feeding tools they have, latch first. Always latch first. And then if the baby is frustrated, crying, pushing you away, then you have the backup. Now, mga nanay, I said this many times. Sa mga pasyente ko, maraming mga nanay na umiiyak sa aking harapan due to frustration. They cried to me. They just want to give up. They don't know how long they can tolerate the discomfort, the pain, the struggle with latching. But you know what? When they come back to me 3 months, 4 months, they're happy, they're smiling because they truly successfully breastfeed their babies after all the struggles. Kaya, sinasabi ko sa inyo, even before, hindi magic. Breastfeeding is not easy for everyone. And I will be lying to you as your nurse educator and your lactation consultant. Sasabihin ko sa inyo, oh, breastfeeding is easy. Oh, breastfeeding is easy. It's not. It's not. Pag may nagsasabi sa inyo ng mga tao o mga healthcare provider na nagsasabi sa inyo breastfeeding is easy, if you feel like you're not agreeing with it, say, no, it's not. Me as your lactation consultant, sa dinami-dami kong mga pasyente ko sa aming breastfeeding clinic, they probably out of 10, probably 2 lang yung nakangiti pag pumapasok sa kliniko. Yung 8 either umiiyak, na-stress, na-depress, na-frustrate, lahat. Nakikita ko yun sa harapan ko, sa kliniko. Kaya, if I hear people saying breastfeeding is easy, yes, breastfeeding will be easier. When the baby gets older, when your milk is already established, when you know what you're doing, and when your milk, mature milk, fully coming in. Pag yung 4 na yun, it's not present right now, so breastfeeding is not easy. You really need to work hard, work harder, or even maybe work hardest. Dahil hindi magic ang breastfeeding. And I've been there. I thought I was doing really good, but I wasn't. So, you people are so lucky dahil ako lang siguro tong lactation consultant na gumagawa ng breastfeeding YouTube channel na to, na nagbibigay sa inyo ng right information na walang kaplastikan. I don't like to give you information that's not true. We want to make right kung ano yung mga mali na na-experience niyo sa mga hospital, because these nurses, most of these doctors and nurses do not have lactation consultant profession. And when you are discharged from the hospital na walang right information, kulang sa information, you feel so hopeless. You feel so helpless, frustrated pagdating nyo sa bahay. So I'm here to help you. If you do have any questions, I will never hesitate na sasagutin ko yung mga tanong nyo. Every day, nag-check ako ng mga messages ko. I am happy na nakakatulong ako sa inyo. I'm hoping na maraming mga healthcare providers who also tune in to my YouTube channel para magkakaroon kayo ng kaalaman. I know there are some of you who are copying me right now, but make sure you're copying the right information when you're teaching your patients. Dahil nakakahiya. Mga edukada kayo, and then pag kung nangungupya lang kayo na hindi galing sa inyo and you're not teaching it right, nakakahiya sa profession niyo. So, make sure you're teaching these moms the right information because they are desperately need our help as healthcare providers. So, thanks again for watching. More videos to come. Please do share this video dahil alam kong marami tayong matutulungan when you're sharing my video. I'm hoping that this coming year, marami pa kayong matutunan from me, and I'm gonna try my best na maika-guide ko sa inyo. So, keep on asking questions. You can message me privately, Alona Forche. If you're too shy to post your questions to me, lagi akong nagbabasa ng mga messages ko. So again, more videos to come. Thanks for watching. Bye for now.